10 challenging NCLEX Next Generation questions with full rationals coming right up. Okay, let's start with question number 1. A 64-year-old client with pneumonia is admitted with suspected septic shock. The vital signs are the following. The blood pressure is 78/42. The heart rate is 132. The respiratory rate is 28 with an oxygen saturation of 90% at 4 liters nasal cannula. The temperature is 39.2 with an lactate level of 4.2. The client has a patent 18-gauge IV and is alert but restless and cold to touch. Which intervention should the nurse implement first? So, letter A, start norepinephrine infusion per protocol. Letter B, blood cultures from 2 sites. Letter C, administration of 30 ml per kilo bolus of balanced crystalloid solution. And letter D, apply a non-rebreather mask at 15 liters per minute. So I'm going to give you 30 seconds to review the question and the answer. Okay, so let's look at the rationals for the correct and incorrect answers. Okay, so let's look at choice letter A. Just want to make sure I have my pen here. So choice letter A says start norepinephrine. So that's the drug of choice for septic shock. It's a vasopressor, right? Vasopressor. And that's the vasopressor of choice for patients who have septic shock, norepinephrine, or what we call Levophed. And it says start norepinephrine infusion per protocol. Now, this is an incorrect answer. And the reason why it's an incorrect answer because you want to have the patient hydrated first before you give a vasopressor. So think about this. The vasopressor would not be very effective if the patient has dehydration. Now, the fact that the patient has sepsis, you expect that there is not enough blood in the intravascular space. Now, choice letter B, it says obtain blood cultures from 2 sites. So this is, in a sense, one of the interventions that you're going to expect with patients who have septic shock, right? Because the reason why they have sepsis is because of infection. And in order for us to determine what antibiotics to use for that bacteria, we need to do a blood culture. Now, in this particular scenario, it looks like the patient has pneumonia as the potential cause of sepsis. Although it's a good response in terms of what to do with septic shock, but in this particular scenario, it's asking for what's the first thing that the nurse need to do. And therefore, letter B is not a correct answer. Now, let's go to letter D before we go to the correct answer, which is letter C. It says apply non-rebreather mask at 15 liters per minute. Now, we see an oxygen saturation at 90%, and it's already at 4 liters. So there is really a tendency that we really need to do some oxygenation or give start oxygen on this patient. However, starting at non-rebreather at 15 liter may be too much at first. Plus, that's not what's being asked, right? What's being asked in the question is, what do you do first? Now, although this is a good response, this one, right? It's not the first thing to do. So therefore, that is an incorrect answer. Now, what is the correct answer? The correct answer is letter C, administration of crystalloid solution at 30 ml per kilo. Now, the reason why, because this is where hydration, so we're putting fluids in the intravascular space. So because that's what you really needed. No medicine is not going to work. Not any of the medicine that we're going to try is not going to be as effective if the tank, I'm just going to call it the tank, is empty, right? So we need to fill this tank with fluids, right? And the fluids in this case, y'all, is the fluids in this case is crystalloid solution. So what is crystalloid? They're similar to isotonic solutions. So for the purposes of septic shock, the best solution would be normal saline. Okay, so let's look at question number 2. A client with, let me look at my pen here, a client with chronic heart failure and reduced ejection fraction is prescribed carbidopa. There you go, the law, right? Which assessment finding would make the nurse question administering the scheduled dose? So letter A's choice is a heart rate of 54, a blood pressure of 110/68, but the patient denies dizziness. Letter B, a heart rate of 88, a blood pressure of 90/56, reports dizziness when standing. Letter C, a heart rate of 76, a blood pressure of 138/84, and is complaining of pedal edema, or there is pedal edema. The last choice, a heart rate of 68, a blood pressure of 60, and there's mild shortness of breaths at baseline. So another 30 seconds for you. Okay, so 30 seconds is up. Let's review the answer and the incorrect answers with rationals. Okay, so let's look at the choices and we determine what is the correct answer and what is the incorrect answer. So I'm going to start with letter A, right? It says, first and foremost, we need to determine what kind of drug is carbidopa. The fact that it is ending in LOL, that would be a beta blocker, right? So a beta blocker is often used for patients who have heart failure. In this particular scenario, the patient has chronic heart failure, and of course with a low ejection fraction. So the fact that it's a beta blocker, so that's our thing in our mind, right? When you have a patient who is on beta blocker, two things that you really want to watch for: the heart rate and the blood pressure, right? Because we want to make sure that the heart rate is not very low and the blood pressure is not very low as well. Okay, so let's start. So it says a heart rate of 54. That's kind of low, right? The blood pressure is 110/68, but the patient denies dizziness. So the reason why this is an incorrect answer, because the fact that the blood pressure is okay, although the heart rate is on the low side, but if you have a heart rate like that and you have a blood pressure that's 110 systolically, the patient is okay. The other thing also that we know that the patient is going to be okay is that the fact that the patient is denying dizziness. So what do we see with patients who have decreased heart rate and decreased blood pressure? Both of them are going to have a perfusion issue, and one of the clinical features of that is dizziness. If the patient gets dizzy standing up or doing things, therefore their blood pressure and their heart rate is not that controlled. So letter A is incorrect. Okay, now let's go to letter C. So letter C says a heart rate of 76, a blood pressure of 138. That alone is telling us that, hey, our heart rate, which is the one over here, and so it's over here, right? It's normal. Although the patient has pedal edema, but remember, patients who have CHF, right? And this is chronic. We don't know whether it's the right sided, the left sided heart failure. It still doesn't matter, because when the patient has CHF, you expect some sort of edema, right, on this patient. So letter C is definitely incorrect. Now, let's go to letter D. The heart rate in letter D, so we're looking at that. The heart rate in letter D is 68. The blood pressure in letter D is 100 over 60. And then the patient has mild shortness of breath. So that's kind of like a little concerning, but the word mild is making it better. But then it says at baseline. So what does it tells us? That at baseline, like normal day for this patient, the patient is having shortness of breath or mild shortness of breath. The other thing to think about this patient again is CHA patient, a chronic at that point, right? So having a little bit of shortness of breath is an expected outcome. So guess what? C and D are expected outcome. So that would not be the correct answer. So what's the correct answer here, y'all? The correct answer here, y'all, is letter B. Now, although the heart rate is 88, which is really within the normal range, but look at that blood pressure. That's very low. And then the patient is reporting dizziness when standing up. So this one is hypotension that is becoming very symptomatic. And that's the reason why that is the correct answer, because that's the one that the nurse had to question when it comes to, do I give the next dose because of this clinical manifestation? So letter B is the correct answer in question number 2. Okay, so let's go to question number 3. A client with DKA is receiving continuous IV insulin. Morning lab shows a glucose of 248, a pH of 7.30, the bicarbonate is 18, the potassium is 3.6. The provider's orders says continue the drip, titrate IV fluids per protocol, recheck labs in 2 hours. What is the nurse's priority? Okay, so letter A, follow orders and make no changes. Letter B, decrease insulin infusion rate by half. Letter C, request an order for potassium supplement. Or letter D, increase the rate of the IV fluids. So again, I'm going to give you 30 seconds to review this question and the 4 choices. As usual, let's look at the choices and the question. Okay, so first and foremost, let's start. We know DKA, right? We know that the patient is going to be hyperglycemic, right? And usually the blood sugar is going to be around 150, perhaps 350, sometimes higher than 450, right? And we kind of see this in patient that has type 1 diabetes, right? We kind of remember that, right? The other thing that we remember with DKA is that the patient is going to have metabolic acidosis, right? Remember the Kussmaul's breathing as well, right? So we kind of remember that, right? And so it actually tells us in the stem that this patient is really have as having DKA at this time. A blood sugar that high, and look at the metabolic acidosis that comes with it. Not really bad, but it's still metabolic acidosis. And because the patient is peeing a lot, so that's another thing you have to remember. If the patient is hyperglycemic, so remember hyperglycemia, remember the patient pee a lot, right? Polyuria, right? If they're hyperglycemic, they're gonna pee a lot. And so peeing a lot is going to lower the potassium. Now, we're still on that range, which is 3.6, which is kind of like on the low margin of the low side. Now, the question is the provider's question, and this is the most important thing. Continue the infusion, right? That's what the order. Titrate and then recheck in 2 hours. So let's look at the answers first. So let's look at answer number two. And it says decrease insulin infusion rate by half. Now, remember, the blood sugar, it's still 248, right? So that would not be a good option. So letter B is incorrect. Now, how about letter C? Request an order for potassium supplement. Supplement. This is somewhat tempting, right? Because remember, the patient is peeing a lot, right? The patient is peeing a lot. So what do we expect with the potassium level if the patient is peeing a lot? It's gonna go down, right? We also know that insulin is going to push the potassium back into the cell, and potentially it's going to lower the potassium level. However, we can't make, so when you take a question like this, don't think of the what if, right? What if? Because then you're going to be thinking, oh, then what if the blood sugar, the patient is peeing and the potassium is going down? And so don't think like that, because then you're going to select the wrong answer. Now, in this particular scenario, because the potassium is 3.6, we don't want to ask for potassium replacement yet, not yet. So letter C is incorrect. And then increase the rate of IV fluids. Now, this is a good answer, right? Increase because the patient is peeing a lot. However, in terms of the scenario that we're getting, it says, what is the nurse's priority action? There's nothing in it that would require us to say, that increasing the rate of the IV fluids is going to help the patient. So definitely choice letter D is going to be incorrect. Now, in this particular question, letter A is the correct answer because everything is already being taken care of. The provider is saying continue at the same rate, right? And then we're rechecking labs in 2 hours. So that would be a scenario where in the lab we're expecting that potassium is going to go down because the patient is peeing and the patient has insulin at this time. Okay, so let's go to question number four. For post-operative clients, call the nurse within 15 minutes. Who should the nurse assess first? Let's look at the option. It says 1 day post-op cholecystectomy with a pain score of 6 over 10, incisional pain, needing analgesic. Okay. Option letter B, 2 hours post-op knee replacement. So it's very, very fresh, saturated dressing, and moderate oozing. So the dressing is saturated. Letter C, 1 hour post-op thyroidectomy with a weak high-pitched voice and difficulty swallowing. And letter D, 12 hours post-op abdominal hysterectomy requesting assistance to ambulate in the room. Kind of like similar to earlier, I'm going to give you 30 seconds. Okay, you all, you know the question already, and this is a prioritization question, which I would recommend and have this mindset when you're taking your NCLEX exam. Expect that all your questions in the NCLEX exam are prioritization question. Because if you have that mindset, it's easy for you to navigate those easy questions. So this is a scenario as usual. You've seen this type of question so many times that talks about, okay, what do we do if you're for a patient? Who are you gonna see first, or who are you gonna assess first? So let's look at the choices. Okay, let's start with choice letter A. It says 1 day, so 24 hours ago, right? Cholecystectomy reporting 6 to over 10 in terms of incisional pain. And the patient is complaining of pain and requiring analgesia. Now, one of the notes that you can, so pain, I'm not saying pain is not important, but in terms of priority, pain is not a priority when NCLEX is asking you questions in your exam. Now, I can tell you in real life, you probably would prioritize your pain, right? The patient's pain. I'm just saying that. Okay, so in this particular scenario, this is not a priority. This is 24 hours post operatively, and the patient requiring pain. So, in terms of priority for your NCLEX exam, this is not what they're looking for as the correct answer. So, that would be incorrect. Okay. Now, letter B says 2 hours. So again, very, very fresh. The patient's fresh after surgery, knee replacement, and the dressing is saturated. Now, it's describing it as moderate oozing, but remember, it's only 2 hours and it's already saturated. So is that a concern? Now, think about this. In 2 hours and the patient is already having a saturated dressing, we have a concern about bleeding, right? But remember, in NCLEX, kind of like you follow a rule, and everybody knows the rule is the ABC rule, right? When you talk about bleeding, you're actually talking about circulatory part of it because that's when blood volume takes into effect, right? So for NCLEX exam, this is not a priority, right? And then let's look at the other choice. So the other choice is saying this one, sorry, I don't have 12 hours post-op, hysterectomy, and requesting assistance to ambulate the bathroom. That is not a priority according to NCLEX. So what is the correct answer? The correct answer in this question is 1 hour post-op thyroidectomy because of potential airway concern. So C is the correct answer for question number 4. Okay, so let's go to question number 5. Are you guys ready? A client with atrial fibrillation is on warfarin therapy and presents to the clinic with bruising and dark tire stools. The laboratory shows an INR of 4, a hemoglobin of 10. The baseline was 13. So they're just giving you the baseline. So it's telling you that it's dropping. Hematocrit is at 30% and the baseline is 39%. Which order should the nurse anticipate? So is it letter A, administer scheduled warfarin and recheck INR tomorrow? Letter B, hold the warfarin, not heparin, and anticipate vitamin K administration. Letter C, increase dietary intake of green leafy vegetables. Or letter D, encourage the client to increase oral intake. And you get that 30 seconds. Okay, so let's check the answer and the incorrect answers. Okay, y'all, so let's look at the choices. So let's start with letter A. Administer scheduled warfarin dose and recheck INR. So in this particular scenario, this is really not the best answer. So that's an incorrect answer because we have an INR that's really high. The patient is already showing signs of bleeding, as you could see over the scenario. Plus, look at the hemoglobin and hematocrit. They're dropping from baseline. So letter A is incorrect. Now, how about letter C? It says increase dietary intake of green leafy vegetables. May be good, but it's not the best choice. Why? Because you need immediate efficacy, right? So you need immediate efficacy. And then letter D, encourage, increase oral fluid. That's not going to help with our bleeding. So we need to stop the bleeding. So letter D is incorrect. And the best answer here is going to be letter B. So when you have signs and symptoms of bleeding, as you could tell from warfarin, right? Because warfarin is an anticoagulant, right? When you have signs and symptoms of bleeding, you need to stop the bleeding. Which one antagonizes warfarin? Definitely vitamin D. Now, if they want a quick, interventions because of bleeding due to warfarin induced bleeding, the best answer, y'all, is fresh frozen plasma. If they want quick, because remember, vitamin K is going to take a while for it to work, right? If they want quick treatment for the warfarin induced bleeding, the best answer is going to be warfarin. I'm sorry, fresh frozen plasma for warfarin induced bleeding. Okay, so our next question. A client with ARDS is on volume-controlled ventilation. The latest AVG or the pH is 7.28, PaCO2 is 58, the PaO2 is 70, and the bicarb is 24. And these are the following vent settings. The total volume is 500, the respiratory rate is 14, the FiO2 at 60 with 10 cm of PEEP. Which ventilator change should the nurse anticipate to correct the ABG? So is it letter A, decrease respiratory rate, letter B, increase total volume, letter C, decrease the FiO2, and letter D, increase respiratory rate? So I'm gonna give you the timer again. Okay, so let's look at the correct and incorrect answers here. You guys ready? Okay, so first and foremost, the first thing you need to do for these questions like this is to determine what the AVG interpretation is. Okay, so we know that this patient is ARDS patient, right? And it's asking what ventilatory change should the nurse anticipate to correct the ABG? Just that statement alone, we need to identify what kind of ABG abnormality this is. Now, if you look at the data that we have a pH of 7.28, a PaCO2 of 58, a bicarb of 24, and you have a PaO2 of 70, right? Now, when you do your ABG interpretation, you kind of don't really need to watch this. You can look at that in terms of oxygenation, but basic ABG for your NCLEX, you look at these three elements. So with that said, this is low, right? This is high, and this is within normal limits, right? So with that alone, your ABG is respiratory acidosis. Everybody agree? Right? Respiratory acidosis. So now let's find a solution or event change that would help us with respiratory acidosis. So choice letter A, it says decrease the respiratory rate. Well, that would not be a good answer, right? If you decrease the respiratory rate, it says currently at 14, guess what happens to your PaCO2? It's going to go up, right? So we're already having problems with respiratory acidosis. So letter A is an incorrect answer. Now, how about letter B? Now, letter B, it says increase tidal volume. Now, is that a potentially correct answer? And the answer is yes. This is a potentially correct answer, right? But usually, what's the first thing that's usually done? So, what you could do is you could kind of like what I did, put asterisk in this because that would be a potential answer. Now, let's go to letter C. It says decrease FiO2. That's what it says, decrease FiO2. Our FiO2 right now is currently at 60%, right? But your PaO2 is at 70, which is on the borderline. And remember, this has PEEP already. It says PEEP of 10. And you have PEEP 10 cm and a FiO2 of 60, and you only have 70 PaO2, that's not a good oxygenation, right? So therefore, letter C is incorrect. Now, the other choice, increase respiratory rate. Now, is this potentially going to help the respiratory acidosis? And the answer is yes, it will help the respiratory acidosis. So we have two options that would be a correct answer. However, in the question, it's not a select all that apply, right? So the best answer here, which usually is working when you have respiratory acidosis, is letter D, not letter B. So letter B is going to be incorrect. Letter D is the correct answer in this particular question. Okay, so question number 7. A client with end-stage renal disease presents with muscle weakness and reports palpitation. The potassium is 6.8. The calcium level is 8.8. Creatinine is 6.0. The cardiac monitor shows peak T waves. Which prescription should the nurse implement first? Is it A, administer oral sodium? Uh, This is basically your kayaksalate, y'all. I have a hard time pronouncing that. This is kayaksalate. Okay, just putting it out there. Okay, So sodium polystyrene sulfonate. Lord, lordy, lordy, right? Letter B, prepare to administer IV calcium gluconate. Letter C, start an IV infusion of normal saline. Or letter D, restrict dietary potassium intake. So, what's your answer in this particular question? Okay, we've ready. Okay, so the patient has end stage renal disease. Okay, the problem is potassium is really, really high. The creatinine is really, really high, and it's already showing peak T wave. So the question is, what is the priority? And choice letter A, administer kayaksilate. That's definitely not correct because if you give kayaksilate, it's going to take forever for it to work. Okay. Choice letter C, start IV infusion of normal saline. That's a good option, right? It's a good option. However, it's not going to treat that cardiac ECG that we're having. As you could say, you already have peak T wave. So that is incorrect. The other thing also is restrict dietary potassium. You can do that, right? But it's too late, right? We have peak T waves already. You have peak T waves, and then your K is now 6.8, right? So this one alone is incorrect. So the best answer is letter B. Why is calcium gluconate the correct answer? So remember, calcium gluconate, calcium gluconate actually does not affect the potassium. There's no effect in the potassium, right? What it does, it stabilizes the cardiac action potential or the membrane, meaning to say it's going to make it less irritable and it's going to hopefully prevent it from having VFib or VTAC. That's the reason why that's the correct answer. Even if you have a choice that says insulin, right, plus D50, right, because that's usually one of the choices that you're going to find with hyperkalemia, right? Hyperkalemia. Still, insulin would not be the correct answer, especially when you have a potassium as high as 6 and you already have peak T wave. Okay? So B is the correct answer. Okay, our next question is number 8. A 7-year-old child with history of asthma or moderate asthma is brought to the emergency room with wheezing, tachypnea, and oxygen saturation of 89 at room air. The child is anxious, using accessory muscles and speaking in 2 to 3 word phrases. Which combination interventions should the nurse anticipate? And this is a select all that apply. Okay, what are the choices? Administer nebulized short-acting beta agonists. Start, letter B, start continuous infusion of long-acting beta agonists. Letter C, administer IV methylprednisolone. Letter D, place the child on 2 liters nasal cannula. Letter E, instruct the child to perform incentive spirometry every hour. Letter F, prepare for intubation and mechanical ventilation immediately. That's what it says, immediately. Okay? Yay! Let's go to the choices that we have, right? It's a select all that apply. So that's it. And so we have more than one correct answer. So remember, this patient has a status asthmaticus, right? Exacerbation of the asthma. And what are the things that we could do? Now, a couple of things. So the patient's still wheezing, right? So that's a sign that we can hear it, right? Has an oxygen saturation of 89 and still able to talk 2 to 3 words in phrases, but using accessory muscles there. Okay. So let's look at our choices. Letter A, administer nebulized short-acting beta agonist. That's the correct answer, right? It's correct answer. Especially when you have an acute asthma attack. You don't want to give anything that's long-acting. So guess what? This one is not a correct answer. First and foremost, we don't give it via IV, right? Because it says IV infusion, but then we don't, that's not our priority. Long acting is not a good choice. Second correct answer is going to be letter C, because giving steroid as an anti-inflammatory is effective during this episode. Letter D is also a correct answer because we want to improve our oxygenation, because remember, the patient doesn't have oxygen yet. So even though the patient is on 89%, we want to bump that up to at least 95%. So giving 2 liters nasal cannula would be a good option. Letter E, you don't have time to do incentive spirometry at this time. That's not a priority, right? So that's an incorrect answer. And letter F is also incorrect because we don't need intubation yet. Hey, remember, the child's still speaking, right? It says speaking to the 3 phrases. So that's the reason why the correct answer in these questions are going to be A, C, and D. That's the correct answer. Let's go to the next question. Okay, so our next question, a 72-year-old client presents to the emergency department with right-sided weakness and slurred speech that began 90 minutes ago. CT scan shows no evidence of hemorrhage. The client's blood pressure is 176 over 96, a glucose of 120, and the client is not on anticoagulant. The provider orders IV altiplase, which is a TPA. What is the nurse's priority action before administration? Is it letter A, start large IV line in the left arm? Letter B, obtain a signed informed consent? Letter C, verify the exact time for the symptom onset with family or family members or client? Place the client on 2 liters nasal cannula, oxygen. Yay! So let's look at the correct and incorrect answers. Are you guys ready? Okay, so as usual, let's look at the choices that we have. Okay, so patient, just by the symptoms that you're seeing on the screen, the symptoms is related to stroke. And it says CT also shows no evidence of hemorrhage. So we kind of know that this is an ischemic stroke, right? Always remember, when there is a symptoms of stroke in your NCLEX exam, you need to do, or you need to look for the choice that says CT scan, because you need to determine whether the patient has a bleed or not. Because if the patient has a bleed, then we can't use TPA. Now, the scenario is telling us that the patient is not taking anticoagulants as well. So that just leads us to the fact that the patient has ischemic stroke, and that's the reason why TPA is the plan of care. Now, let's look at the question or the choices. Start large IV line in the left arm. Actually, this is correct options, right? You need to have an IV line before you even start the TPA, right? Before you start this TPA over here, you want to have an IV line because guess what? You don't want to stick a patient who's already taking TPA because you don't want them to bleed, right? So, although that's a correct answer, but that's not the priority action at this time. So, the question is asking, what do you need to do first, or what's the priority action? So, letter A is not a priority action, although it's a good option, right? Letter B, obtain informed consent. That's also a good option, right? But it's not a priority at this time, right? I mean, you can do that as you do other things while talking to the patient, but there is one most important thing that you need to do because you can't give TPA unless you know this particular information. So letter B is incorrect, as well as letter D is also incorrect, right? So the correct answer is letter C. And the reason why letter C is the correct answer because there is a time frame. I know there is a very strict time window when you start TPA. TPA. Just going to put it like that, right? So the literature is going to tell you it's 3 to 4.5 hours. That's what the evidence, so evidence-based practice, is telling us. So knowing it is going to be a priority so that you can start your TPA. Now, it tells you in the stem that it's around 90 minutes, but the choice it says with the patient or with the family member. So letter C is the correct answer in question number 9. Okay, so let's look at our last question. A post-operative client received 2 milligrams of hydromorphone 20 minutes ago for a severe pain. So it's 10 over 10. The nurse now finds the client difficult to arouse with respiratory rate of 8 breaths per minute and O2 sat of 88% at 2 liters nasal cannula. What is the nurse priority action? Letter A, call the provider to report over sedation. Letter B, administer naloxone per PRN order. Letter C, increase oxygen to 4 liters nasal cannula. Or letter D, stimulate the heart and stimulate the client and recheck vital signs in 15 minutes. So let's find out the timer. Yay! So let's look at the choices as usual. So the patient, you you may have figured this out already, is took Dilaudid. So this is actually Dilaudid, right? And Dilaudid is an opioid. Now, 2 milligrams is really big though. So, right? And so, but the patient was complaining of 10 out of 10. And so the scenario is telling us that after that, the patient becomes difficult to arouse. So that's telling us that we're having some opioid issue that has been given too much. Now, although choice letter A is a good option, calling for help and letting them know, but that's not the priority that NCLEX wants you to answer, right? Increasing the oxygen is also not a correct option that NCLEX wants you to do. I know the O2 sat is at 88%, and stimulating the patient is also not what NCLEX is looking for, because guess what? It's talking about delayed care, right? It says monitor 15 minutes later, right? The best answer here, y'all, is, you guessed that right, administration of Narcan per PRN orders. So that's it, our challenging 10 NCLEX Next Gen questions. If you could share your scores in the comment, the better. Thank you very much for watching, and tell your classmates and friends about this channel on YouTube.